Hi, Dr. Mike Denninger here with the next in the series of trauma treatment tips for practitioners. In this video, I'm going to talk about two different topics. The first is why MEMI doesn't waste any time focusing on irrational cognitions. And the second has to do with reasons why MEMI achieves results much faster than EMDR. So let's start with the first topic. You know, the most popular trauma treatment therapies, or the ones that we would call mainstream, like cognitive behavioral therapy or prolonged exposure or cognitive processing therapy, and even EMDR to a certain extent, ascribe to a theory that irrational cognitions are the cause of maladaptive emotions and behaviors related to problems. You would know that because they use techniques like, for example, thought stopping. In this example, when someone is coming out with an irrational thought in relation to their problem that they're presenting, the practitioner would help them identify how that thought is irrational and teach them how to begin to interrupt that thought and then redirect the thought to a more positive narrative about the problem. And that redirection is called thought redirection. And the third technique is called cognitive restructuring, which actually encompasses both thought stopping and thought redirection. But in cognitive restructuring, when people are stuck and sometimes in a repeating cognitive loop related to a problem that they have, like, I should have done something to stop it. I should have done something to stop it. I'm no good. I'm this, I'm that, right? These are irrational thoughts about a problem. The therapist helps them reconstruct an idea, a way of focusing, a way of thinking about that problem without that negative aspect. So cognitive restructuring is actually very helpful. Now, behind this theory, and with the idea that irrational ideas are the cause of emotional and physical symptoms related to a problem, it requires a lot of time in therapy to be focused on the cognitions. So a lot of time would be given to stopping what they're talking about and asking what the thoughts are now, and assessing whether they are actually negative, irrational, and need to be readjusted in order to confirm what is a consistent positive narration about the problem that they're having. Because of this, the therapists spend a lot of time having clients talk about what's going on with them out loud in their own voice, and reconstructing in their own words how they think about the problem, thinking that this will change the reactions that they have to it. Now, we don't do that in MEMI. We don't believe necessarily that in the context of trauma treatment anyway, that irrational thoughts are the cause of these negative reactions to a problem. If they were, then if you didn't change those irrational cognitions to rational ones as soon as you identified them, then the therapy wouldn't work. In MEMI, though, it's not that we don't focus at all on thoughts. At the beginning of a session, we ask them about the thoughts that they have in this way. We might say, okay, when you think about that experience, what thought comes up for you? Or what do you hear yourself saying inside to yourself? We don't assume that there's going to be an irrational thought, and we certainly don't point out that they might have an irrational thought. Oftentimes the thoughts are irrational, but we don't comment on that. We just write down the thought. So if it's my fault, I should have done something to stop it, we write it down. But suppose a client said, it's a really unfortunate thing that happened. That's not an irrational thought. It's correct, and by all assessments, right? In EMDR, for example, they would encourage a client to come up with a negative thought or a negative self-assessment about the problem, like I should have done something to stop it, or it was a horrible thing, I must be a horrible person. Negative self-assessments or negative cognitions about the thought. Like I said, in MEMI, we don't do that. We don't believe that cognitions need to be changed if they're negative in order to desensitize problems related to something that happened to someone. So that's the first aspect. And mind you, a lot of time in EMDR and these other therapies is spent in identifying cognitions, assessing cognitions, teaching how to stop the cognitions if they're negative, and how to redirect them and reconstruct them into more positive narratives about a problem. Now, the second topic has to do with reasons why MEMI desensitizes traumatic memories much faster than EMDR. In EMDR, the current problem is thought to be related, be connected to earlier pathology or earlier issues that are of the same nature or have the same theme. So, for example, if the current problem is related to some kind of betrayal, if a husband or a spouse cheats on their partner, then after an eye movement set, bilateral saccades, the therapist might ask, what comes up for you now? It may not relate to what the current problem is. It may relate to a betrayal that was earlier in life. But the assumption is made that this is not the only thing that we need to extinguish here, these feelings that are related to this particular problem state. We need to identify all of the earlier instances of the same nature or with the same theme, and those also need to be desensitized with a set of bilateral saccades. Because of this, EMDR spends a lot more time with eye movements in a session. In MEMI, we have 4 eye movement sets, and because we don't assume that the current problem is connected to an earlier pathology or to an earlier problem of the same nature, of the same type, or with the same theme, we only focus on the current problem state. We desensitize it with the 4 eye movement sets that we use, and then we move on. Now, in a MEMI session, we might only do 2 or 3 eye movement sets. Oftentimes, by the end of the 3rd set, the problem has been desensitized to a place where the client says, yes, I think it's going to be manageable going forward, and I'm ready to stop. On occasion, we will do a 5th set, but that is unusual. So the amount of time that we spend in MEMI doing both focusing on cognitions, for example, like we don't, we will ask them for that cognition in the beginning, and then later on after an eye movement set, we'll say, okay, when you think about that experience again, what thought comes up for you now? And if they say, oh, it's really unfortunate that that happened. It might be completely different, more rational than when they started with, for example, it's my fault. It's just unfortunate that it happened. So there's a transition in the cognitions that is natural, that's automatic, and that occurs after the sensory, the imagery, the auditory input, and the physical feelings, the emotional feelings, and the tactile feelings have been desensitized. We have confirmed this with years and years of clinical experience, and we don't believe that this focus on cognitions or irrational cognitions is really important at all in desensitizing memories. So these are the 2 topics that I wanted to cover today. Thank you for listening, and we'll see you again the next time. Bye now.